It's hard to ignore when your feet hurt. It's not like you can pretty much stick them in a sling and forget about them for the rest of the day. Something that hurts you with every step that you do really comes in the way of carrying out your activities of daily living.
I am coming because my bunions.
Dr. Joel Brook of Dallas Podiatry Works is Dallas-Fort Worth's premier bunion specialist.
What causes them and what can you do about them?
Bunions are caused by muscle imbalances that are occurring in your feet. There is always a talk as to whether or not your shoes are causing your bunions or not. And I don't know that I can go there. There was one study published once that evaluated a patient population in the third world, and they showed that they had less of a prevalence of bunions than those patients in the developed world. And if you take that and you extrapolate that, whether it's scientific or not, then that would lead you to think, okay, people in the developed world are wearing shoes, so therefore the shoes are the cause of the bunion. But what happens is, it's my feeling that you're born with a function and structure of a certain foot type. You have a certain foot type. And could shoes be a contributing factor? They could be, but you have to be predisposed to develop them. We see bunions in children, people who have not yet started to wear the types of shoes that you think would be associated with developing drifting of your toes. So it really has to do with how your foot functions.
What is a bunion exactly?
There are two parts to a bunion. The first part is that your big toe, your great toe, drifts outwards towards your little toe. But the thing that you can't see, that you need an X-ray to really demonstrate, is that the first and second metatarsal bones, there's an increased distance between the first and second, where the first one drifts in as the great toe drifts out.
What can you do for bunions?
The first thing to do from a conservative standpoint is not wear shoes that irritate the deformity that you have. Everything is not necessarily a surgical problem, and if you have this condition that is not quote-unquote normal but is not causing you any pain, there's no reason to rush into an operating room to fix it. So the first thing to do is shoes that accommodate it, pads that could help cushion it and keep there from being excessive friction on the area because it irritates the bone and the nerve and the skin. You can take medications to symptomatically treat the pain, anti-inflammatory medications. You can use ice, injection therapy, topical analgesics. I don't think that you should be walking around in pain or discomfort, because so much of what's out there that people just assume are things that you have to live with, you don't have to live with. And people can get a significant amount of relief with some of these measures that we talked about, both conservative, and then there's also surgical things that can be done to repair these deformities.